Welcome back to We Are Austin. You know, knowledge is power when it comes to your health. So if you're thinking about getting a screening, the team at ARA Diagnostic Imaging can help. Dr. Azizad is here to discuss when it's a good time to take a closer look at your lungs. Thanks for being with us.
Good morning.
So it's a term we've heard, but what is CT lung screening and why is it important to do?
All right, so a screening exam in general is something that's done before you have symptoms of it, similar to how you'd get a mammogram for breast cancer or you get blood work for cholesterol or diabetes screening.
Yeah.
So lung cancer is the leading cause of cancer-related death in men and women.
Wow.
So in 2014, about 435 people a day died of lung cancer.
Oh my goodness.
So the U.S. Preventive Task Force in 2013 came out with a recommendation for annual low-dose lung cancer screening CT. So if the reason we say it's important to get checked before you have symptoms is if you get checked or if you present with symptoms of lung cancer, you have about a 17% survival rate, 5-year survival rate after that.
Wow, my goodness.
And the comparison between a CT versus a chest x-ray is about a 20% increased detection rate.
So yeah, who is it recommended for and what are we looking at here first?
Yeah. So most of your viewers are familiar with a plain chest x-ray, which is like a front and side view of your lungs, but a CT is x-rays shot around your entire body, and we compile hundreds of images together to look at your body within like a tenth of a millimeter.
Yeah, so it's really comprehensive.
Yeah, you can see, and so all the black stuff is air, but then all the white stuff that you're seeing is just your lung markings and your vasculature.
So you get a lot of information from these.
It's a lot more information, yeah.
So who is it recommended for should really make this a priority to get a screening?
So the number one population that should get it is smokers, current or former smokers. 90% of all patients who have lung cancer are smoking patients. So that's whether you're a current smoker or you've quit within the past 15 years, patients within 55 to 80 years old, and if you've had a 30-year pack smoking history, so that's either 2 packs a day for 15 years or 1 pack a day for 30 years.
So what if you're a smoker but maybe not in this highest risk group? How would you encourage them to proceed as well?
So in general, as physicians and as radiologists, we discourage unnecessary imaging because in general, the benefit of an exam you get should outweigh the risks of the exam you get. So one thing would be radiation exposure, but then secondly, we may find things that we didn't need to find, and then you may find yourself getting additional exams and biopsies that you didn't need. So in general, it's not recommended. And also, backtracking to who it is recommended for, Medicare covers it in the high-risk population, so it's been deemed, so it's deemed like essential for that population to get it.
So let's talk about what happens if you do find something.
Sure. So it depends on what you find. So lung nodules, a lot of things can cause lung nodules in people, whether it be infection, an old infection or a new one, or cancer. So you may get additional exams depending on what we find in the beginning. So I can show you some images if you're interested.
Yes, please.
Now.
So what are we looking at here?
So this is a typical, what we would call a ground glass nodule. So when we do a screening exam, like you've never had an exam before, and we see this in you, we're not immediately going to say, go get a biopsy. We'll say, probably depending on the size, either a 1-month follow-up or a 3-month follow-up, because this is kind of a bigger nodule. And then in this particular patient, it just completely resolved in 3 months. So it was just an infectious or inflammatory nodule.
Oh, interesting. Okay.
But similarly, this is also a ground glass nodule, and in this patient, it did end up being cancer. So then you get biopsied and treated.
Yeah.
And similar, even though this is actually a solid nodule, but it's a simple lymph node. It's benign. And we know that just based on its location and its imaging features.
How interesting. So how does someone get a screening? What's the best way to approach that whole process?
So if you are in that high-risk population, I would recommend discussing it with your physician, and then they'll refer you similar to how you'd get any other, like a chest x-ray or whatever. But there's no prep required. You just show up, and there's no eating or whatever. Yeah. And also, I would recommend making sure the place you choose to do it is designated as a lung cancer screening facility, and they're accredited by the American College of Radiology, just because that means they'll be doing it with the appropriate radiation dosing, the proper follow-up for the patients, and that sort of thing.
This is such helpful information. Thank you. And it's really great for all of us to be proactive about our health and feel like we're educated and informed as we do it. So thank you for explaining that to us. So we can put more information up on the screen about ARA. If you want to head to ausrad.com for more info, or you can pick up the phone and give them a call to ask some of those questions and plan ahead to be proactive about your health. Thank you so much.
Thank you.
Stick around and get